This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning, Dr. James Holehouse, Mon Health Preston Memorial Hospital, OBGYN, and Crystal Nestor, Mon Health Preston Memorial Hospital, OBGYN. Dr. Holehouse, good morning.
Good morning.
And Crystal, good morning to you.
Good morning.
Thanks for joining us this morning. Obviously, if we're talking about OBGYN, we're going to be talking about women's care. We'll get into that subject in just a moment. But as we always do, first, I'd like to get to know our guests just a little bit better. Dr. Holehouse, we'll start with you. Just tell us a little bit about your background, where you went to school, and how you ended up working with Mon Health.
Well, I'm originally from New York. I was there till age 15. I moved to Florida, where I did my training. I did my residency at University of South Florida, and then came to Buchanan for my first 2 years, and then moved to Morgantown, where I spent the next 20 or so years in practice with Dr. Rollins. And then I'm back with Mon General through Preston Memorial. And
Crystal, a little bit about your background.
Yeah, I'm from Newburgh, a small town in southern Preston County. So I'm excited to be back providing care to members of my community. I earned my first master's degree as a family nurse practitioner from WVU in 2009. And then I always had a special interest in women's health. So then as I finished having children of my own, I decided to go back to school and did my specialty degree as a women's health nurse practitioner and completed that at Kent State University in 2023.
And Dr. Holehouse, why did you choose the specialty to work with OBGYN?
I just liked OBGYN because it had a nice mix of both primary care and specialty care. I enjoyed the primary aspects, but also I really enjoyed the surgical aspects of GYN.
And Crystal, you touched on it a little bit there, but if you could elaborate a little bit more why you chose the specialty.
I enjoy caring for women at all stages. I feel that I can help them with their concerns, whether it be educating them about something that's a normal process, or if they need have a problem, that we can address that as well.
And I'm just going to throw this out there that I don't know what the right word to describe the feeling, but it has to be gratifying, I guess, to also you get to be part of one of the most special times in families' lives as well. That's got to be, I don't know how, can you describe that, Dr. Holehouse?
Yeah, I think being able to follow a patient closely for 9 months and then get a gift at the end. And the real gift is not only the newborn, but the great relationship that you develop with the parents. It's a lifelong experience. I continue to see patients that were delivered. I'm now delivering children of their children, so it's interesting and very gratifying. Thanks for bringing that up.
And Crystal, same to you. Am I in the ballpark there?
Yes, absolutely.
All right, April is Women's Health Month, and we're going to focus on women's care, obviously. And the actual focus today is women's care, any age, any stage. Dr. Holehouse, can you talk about what this means, the different types of care that are provided at Mon Health?
I'd like Crystal to go ahead and handle just the younger patient, and I'll handle the older patient.
All right. Okay.
Crystal, younger patients, what kind of services are available?
Yeah, so we see, from young teens with menstrual irregularities that may have contraception concerns. And then we also see patients during their pregnancy, and any type of menstrual issues that come up during that. And then we follow them through, perimenopause and menopause, which Dr. Holehouse can give you a little bit better.
Dr. Holehouse, go ahead.
Actually, I really like our team. I've got Crystal, who is a vibrant and very interested and intelligent woman. I enjoy working with her. Her eyes are wide open. She's open to everything, and it's a good relationship between her and I. I've got a little more experience, and we can bounce things off of each other. But I have focused my practice primarily on the menopause and postmenopausal woman.
And go ahead, because what kind of services and what kind of, I guess, doctor, I don't want to call it issues, but issues arise for women in that stage of life?
Yeah, I think there's a lot of controversy, a lot of discussion on the pros and cons of hormone replacement therapy. Obviously, the bottom line is that you need to be taking care of yourself and take an active role in your own health, weight loss, and exercise and diet. But beyond that, I see a lot of patients interested in potential for hormone replacement therapy. We are very careful in doing a good triage to be able to figure out risk factors, who are good candidates, who are not good candidates. But I do think that for all patients that we see, we're able to offer them something at the end of the day. Maybe they're averse, or maybe they're not good candidates for estrogen and progesterone. But one of the things that kind of make our practice stand out is that I am pretty pro testosterone therapy for the female, which seems a little bit controversial, but it should not be. Testosterone is one of the strongest hormones in the female body, and unfortunately, it's been ignored throughout most of the training and most of amongst a lot of GYNs. So I see tremendous benefits for the elderly patient who is loss of bone, loss of muscle strength, loss of libido, depression. Testosterone is an excellent hormone to be able to augment those things and has minimal, very, very little risk.
Crystal, let me jump back to the other end of the spectrum because I'm sure you get this question all of the time. What's the appropriate age for a young woman to go see an obstetrician or OBGYN for the first time?
I think it just depends on the patient themselves. I mean, we've seen, young teens that are having irregular menstrual cycles or something to that nature, and sometimes they just need, some education that will kind of work itself out as they develop. And then sometimes, they need a little bit of a birth control pill or something like that to kind of help set the system so that they're regular. So an exact age, I'm not sure. Of course, we start pap smears and that kind of screening at 21, but we definitely see patients anywhere from 14 and up, or possibly younger if they're having an issue.
Is that a decision that will ultimately be made, by the family, the parents, and I guess the pediatrician at that point?
Yes, I believe so.
Crystal Nestor, Mon Health Preston Memorial Hospital OBGYN, and Dr. James Holehouse, Mon Health Preston Memorial Hospital OBGYN, joining us this morning. We have more to come as we continue our conversation. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. James Holehouse, Mon Health Preston Memorial Hospital OBGYN, and Crystal Nestor, Mon Health Preston Memorial Hospital OBGYN. We're talking women's care, any age, any stage. And Dr. Holehouse, how often do you recommend patients see their OBGYN?
As Crystal said, it's going to depend on the patient, but there are certain guidelines that we look at, and there's no consensus. Every 2 years. Now, a lot of patients will use OBGYN as their primary care, and they should be seen annually. If they have a family practice doctor and internist that they see, and they're just coming for GYN and they're with no complaints, it could be every 2 to 3 years. So it all depends. And my part of view, where I come from, is that I see a lot of problem-oriented patients. So we have a full surgical complement to our practice, and so I see patients for urinary incontinence, pelvic organ prolapse, irregular bleeding. And the nice thing about our practice as compared to before is that we have a great association with the Med Center in Morgantown. So if there's something that I feel uncomfortable with or that I think I need assistance with, they're more than ready to either take over or come up here and help. So it's been a very positive relationship between Preston Memorial and Mon General.
Crystal, what are some things that women should keep an eye out for in between those regularly scheduled appointments that may prompt them to visit the office in between?
I think, if they would happen to have irregular bleeding or bleeding between their periods or pelvic pain, or in postmenopausal women, any type of bleeding would be definitely a concern to come in and be seen for. And then they should also be aware for, signs of an infection also. So those are some big issues.
Dr. Holehouse, you've mentioned some of these, the services and expertise that are available through the women's health providers here at with Mon Health. But besides, I guess speaking from my perspective, and it's one perspective, you think OBGYN, you think babies, you think perinatal care, menopause, those sorts of things. But what other services and expertise are available?
One of the reasons I went into gynecology in particular is that at the time, the top 5 surgeries in the country were GYN. So GYN is a strongly surgical subspecialty. And so patients can feel very comfortable coming in with whatever problems they have, coming here, and I can triage them very easily. I've been at it for a long time. I have a lot of competencies in a lot of areas, but there are some areas, such as in cancer treatment and stuff like that, that we have a wonderful team at Mon General that are always available and ready to help out.
Our guest this morning, Dr. James Holehouse, Mon Health Preston Memorial Hospital, OBGYN, Crystal Nestor, Mon Health Preston Memorial Hospital, OBGYN. Crystal, love to pose this question from your perspective. Dr. Holehouse mentioned this earlier, the team that is available through Mon Health. Talk about your role in that team and what it's like working with that team-like mentality there at Mon Health Preston Memorial Hospital.
Yes. So I joined Preston Memorial Hospital several months ago. And so we are in the process of seeing some early OB patients at Preston, which is a new service that we've not had for a while. And then, of course, when we bring those patients on board, we don't deliver at Preston Memorial, so we kind of collaborate with the Mon Health OBGYNs. And, we would start their prenatal care, but then, of course, they would kind of eventually transfer to here so that they can meet the providers and deliver later in pregnancy, probably around 20 weeks or so. So I play a role in kind of providing that care close to home for them in the beginning of their pregnancy, and then kind of providing that transition to get them where they need to be to deliver later in pregnancy.
And Dr. Holehouse, your perspective on working with the team at Mon Health.
And there's just a comfort level. I feel very confident that any patient who comes through these doors, that we can service them one way or another. And there used to be, in times past, a bit of turf wars or competitiveness, and which just doesn't belong in medicine. And the nice thing that now that we're under the umbrella with Mon Health, there's absolutely no restrictions. There's nothing that would compel us to go one way or the other. What's in the best interest for the patient is what they get. There's in the area of robotic surgery and stuff, I personally don't do it, so I'm very comfortable sending patients down that way if I feel like that's what's going to be best for them. So instead of me making an incision on their belly and taking a large uterus out, I can then send it down and feel very comfortable that they can get the best care and independent of whether they stay here or go elsewhere.
And Crystal, you mentioned earlier you're from Preston County, grew up Newburgh, I believe, if I heard correctly.
Yes.
How important is it, or is it a convenience? Is it a comfortability factor to be able to have these types of services and this type of care available right there at Preston Memorial and not have to go to Morgantown or somewhere else?
Yes, I think it's both. I think it's a convenience issue. I think that the transportation is a problem for the area. So to be able to provide those services closer to where they live is a convenience thing. And then also, you're more comfortable if it's a provider that you're familiar with or that you've seen. And so it's nice to be able to provide that full spectrum of care for women.
Talking to Dr. James Holehouse, Mon Health Preston Memorial Hospital, and Crystal Nestor, Mon Health Preston Memorial Hospital, both with the OBGYN. Got to take our final break. We'll wrap up our conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. James Holehouse, Mon Health Preston Memorial Hospital, OBGYN. Crystal Nestor, Mon Health Preston Memorial Hospital, OBGYN. Just a couple of minutes left before we have to wrap up. And Dr. Holehouse, I'll start with you. We've kind of been talking in broad terms this morning when it comes to women's care, but what do you want listeners to take away from our conversation today?
I want them to feel very comfortable coming to Preston Memorial, knowing that they'll get comprehensive care and the best care that can be provided. If we cannot provide it, we have a backup system through Mon Health that we can allow the patient to go to. The other thing quickly, I just want to emphasize that hormone replacement therapy may not be for everybody, but I think everybody should be evaluated. Everybody should be given a chance to make a decision for themselves, whether it's right or not. So feel very welcome to come here and discuss those issues with me.
And Crystal, let me toss the same question to you. What do you hope people take away from our conversation here today?
I would agree with Dr. Holehouse. I just want everybody to feel comfortable to come to Preston Memorial. And like you said, if we, can't provide what the services that you need, then we have a backup system and a collaborative team that we can reach out to. And
Crystal, what do you want to say to, possibly patients who've never been before, might be apprehensive about coming to see the OBGYN maybe for the first time, or maybe they haven't been in a long time?
I think Dr. Holehouse and I make a good team, as he has said earlier. Sometimes being a female, you can relate a little bit different to patients. So definitely, I think between the two of us, with his expertise and, my just being a female and, new age provider, I think that the two of us together make a good team, and we can take care of pretty much anything that you guys need. And
Dr. Holehouse, I'll give you about 30 seconds here for the patients who maybe they've, again, never been, or it's been a while and you might be a little bit apprehensive about going to see the doctor and admitting that you've not been in a few years.
Well, I like the idea that you're close to home, and they're going to feel more comfortable seeing somebody close to home. A lot of the patients here just don't like going to the big city. They like having care regional, and I think they should be very comfortable with us, and we'll provide them whatever their needs are.
Of course, you can always get more information and get contact information as well. Go to the website, monhealth.com/OBGYN. Dr. James Holehouse, Mon Health Preston Memorial Hospital, OBGYN, and Crystal Nestor with Mon Health Preston Memorial Hospital, OBGYN. Guys, thanks so much for being part of the show this morning. I appreciate it.
Thank you. Excellent job.
Thank you very much, Dr. James Holehouse and Crystal Nestor